equity is not a problem only for healthcare services.
Financial problems, regulatory problems,
the challenge of measuring
technology literacy,
internet infrastructure.
Sheba Medical Center is the largest hospital in Israel and in the Middle East. It's not only the largest hospital, but it's also been ranked for 4 years in a row by Newsweek to be one of the top 10 hospitals in the world. Sheba is a comprehensive hospital.
The unit for reducing disparities in health has existed in the Ministry of Health since 2010. The unit sits within the Strategic and Economic Planning Administration of the Ministry of Health in Israel. The role of the unit is to reflect gaps in the health between different populations in Israel, as well as to plan and promote policies to reduce gaps in the health system.
The Galilee Diabetes Sphere really aims to address the disparities we see between the center of Israel and the northern periphery in diabetes and its complications. It stems from the understanding that health equity is at the heart of this issue. And SPHERE is actually an acronym for Social Precision Medicine Health Equity Research Endeavor. And how can we account for the disparities we see and create an integrated model where we address the social determinants of health along with precision medicine to make sure that we improve the health of populations residing in social geographic peripheries?
A little bit about the American Hospital Association and about me, and I'll start talking about the AHA. So we are the national trade organization representing over 5,000 hospitals and healthcare systems across the United States. And we have two teams. So our team in DC is really focused on policy and advocacy at the federal level to ensure that any new policies or regulations support hospitals' needs. On the Chicago team, so where I am based, we're focused on what we call member assistance. In other words, how can we best support the hospital field to care for their patients and their communities? And we do this through live and through virtual education, through developing learning cohorts, writing thought leadership pieces, doing research, and so on. We also have professional membership groups that provide resources to specific professions within a hospital, like nurses or healthcare strategists or HR professionals, etc.
Hi, my name is Amy Schoen. I am a full-time digital health equity consultant with my own firm, Public Health Innovators. I have 30 plus years experience working at the intersection of public health and medicine, with a lot of focus on innovation and technology.
Today, there is understanding in Israel and also around the world that disparities in health are caused both by factors within the health system, such as accessibility and availability of health services, and especially by social factors called the social determinants of health. These are the conditions in which people are born, grow, live, work, and age. They include factors like socioeconomic status, education, neighborhood and physical environment, employment, and social support networks. In fact, between 80 and 90% of persons' health is determined by those factors. In order to reduce gap disparities, the healthcare system must cooperate with other social systems such as the welfare system and the educational system.
All of these factors actually come into play and affect what health systems later see in terms of health and health outcomes. So it's not only a question of access and quality of care, it's actually a much more wider phenomenon that actually requires a lot of stakeholders to think, what's at play when we talk about health equity? When we actually understand and want to really understand the role of healthcare systems within all of the different factors that really affect a person's health and health outcomes, or if we look kind of and try to assess the different factors and give each of them a weighted score of how much they actually affect a person's health, we're talking about the role of health systems being accountable for about 20% of the disparities that we see. The other reasons that we really see differences in health and health outcomes are a result of the social determinants of health, and that accounts for about 50% of the reason that we see disparities between different communities.
There are many challenges to telemedicine services. Of course, there are technological challenges. We have to make technology simple, easy to use, and accessible to anyone. We have also regulatory problems. We have financial problems. We need to make good reimbursement plans for clinicians and for healthcare organizations and providers. We have small ethical problems regarding what can we do from distance and what we cannot do from distance. And we have a lot of accessibility issues. Well, accessibility doesn't only mean internet connectivity to anyone, but it also means to make these technology accessible to people who don't have money to buy smart devices and smartphones. We have to make it accessible for people that have disability, that speak different languages, that are elderly or have different cultures. And this is a problem that we have to address. Another challenge that we had to address, especially before COVID-19, was the transformation that we had to undergo, both as patients, but moreover as clinicians, to accept that we can do medicine from distance and that it can be equal to face-to-face visits. And this is a transformation that we needed to undergo, and we still have to work on it.
The way you measure inequality reflects and affects the action you take. You can measure it, the differences between center and periphery, by socioeconomic status, by nationality, by sex, and a lot more. In order to succeed in the challenge of measuring inequality, we have carried out a process of determining certain indicators of measuring inequality in Israel that will be published soon by the CEO of the Ministry of Health. And according to these indicators, we will be able to measure inequality, and most importantly, we can determine if we succeed or didn't succeed in reducing the gaps.
So when we talk again about the challenges, the major challenges of addressing health equity, it's first of all understanding the greater vision that health equity is not a problem only for healthcare services. It's a wider societal problem that stems from structural societal barriers that affect really the community at large. And so it's a major question for both healthcare systems and the technological solutions that can be relevant for health equity, to think who are the other stakeholders that need to be part of the solution that we address? Who should be also persons that we're talking to? It can be NGOs serving the community. It can be the municipalities who are really in charge of what goes on in the city in terms of infrastructure. So there are a lot of other stakeholders that we need to account for when we think of possible solutions to address the issue of health equity, to making sure that different people residing in different places receive the right care at the right time and is accessible to them in a way that they can use it. And that can't be just for health systems. It's a wider societal approach that calls for other stakeholders to be part of the discussion, both in terms of giving the technological solutions as well as removing the wider social structural barriers that affect people's health.
Access to internet. We know that we need good internet to use digital health tools, and that's not always available. So a little bit about the situation that we're seeing in the United States. Nearly 30 million Americans don't have access to broadband internet. More than 30% of rural residents lack broadband services, and racial and ethnic minorities, Indigenous people living on tribal lands, older adults, and people with lower levels of education and income are even less likely to have broadband access. That second dimension is devices. So 24% of individuals living in rural areas own a cell phone, but not a smartphone. As a result, these individuals can't take advantage of mobile health apps, patient portals, or healthcare services offered through telemedicine. So we really need to think about the devices that people have access to that they can use for their health. Technology literacy. So we know that cultural or linguistic barriers can limit people's use of digital solutions, or they may struggle to comprehend the information in digital formats. So we've seen people are starting to use digital health navigators to teach people how to use their devices, but one demonstration might not be enough. People need to have the skills and the confidence to be able to use the digital tools available.
If you're thinking about where geographically digital health technology can be used, that can be generally anywhere. However, you do have to be aware of the internet infrastructure that's available in the area where a person would be using the technology. So if you're using a technology that requires real-time geolocated data and movement data and the like, if the person is living in an area that doesn't have a good internet infrastructure, the cellular service may not be good. And so the system will not be accurately recording their information.